The family dinner invitation came 3 days after my second round of chemotherapy. Celebration dinner this Saturday to announce Melissa's engagement. Everyone must attend. Formal attire. 7 p.m. at Marcello's. I stared at the text from my mother, barely able to lift my phone. Saturday was day 4 post-chemo. When the nausea peaked, when my white blood cell count bottomed out, when even sitting upright felt impossible. My oncologist had specifically told me to stay home and avoid crowds. The infection risk was too high. I typed back with shaking hands, "Mom, I can't. I'll be too sick from chemo. I'm immunocompromised. Can we do something at home next week?" Her response came in seconds. "Alexandra, your sister gets engaged once in her lifetime. You can push through some nausea for one evening. Take Zofran and come. This is important. Push through." That's what she'd been saying for 6 months, since my stage 3 breast cancer diagnosis. "You're being dramatic," she'd said when I first told her about the diagnosis. My mother was a nurse practitioner with her own family practice. 20 years of experience, respected in the community. To her, my cancer was an inconvenience that interrupted family life. "Breast cancer is so treatable now," she'd dismissed. "You'll do chemo, maybe some radiation, and you'll be fine. No need to make it your whole personality." At 31, I was the oldest of 2 sisters. Melissa, 28, was the golden child. Marketing executive, social media influencer, now engaged to a real estate developer. My mother posted about her constantly, "So proud of my successful daughter." I was the problem child. The graphic designer working from home, the one who'd always been sickly, the one whose cancer diagnosis was treated like a deliberate attempt to steal Melissa's spotlight. "Why did you have to get cancer during Melissa's big year?" My mother had actually said during my first chemo session. What my mother didn't know was what I actually did for work. I wasn't just a graphic designer. I was a medical illustrator specializing in nursing education materials. I created anatomical diagrams, patient care protocols, and clinical procedure guides for nursing schools and hospitals nationwide. I also consulted for the State Board of Nursing on educational standards and professional practice guidelines. I reviewed nurse practitioner scope of practice cases. I served on the committee that evaluated complaints against licensed nurses, including my mother. 3 months ago, a formal complaint had been filed against her nursing license. A patient reported that my mother had dismissed chest pain as anxiety, refused to order diagnostic tests, and sent the patient home with instructions to relax and stop worrying. The patient had a heart attack 12 hours later and barely survived. The complaint had been assigned to my committee. I'd immediately recused myself and disclosed the family relationship. But I'd seen the file. 6 similar complaints spanning 2 years. Patients whose concerns my mother had dismissed, symptoms she'd minimized, diagnostic tests she'd refused. Her nursing board review was scheduled for 3 weeks from now. She didn't know I knew about it. And she definitely didn't know I'd recused myself from her case. I decided to go to the dinner. Not for Melissa, but because I was tired of my mother calling my cancer attention-seeking. Build up. Saturday evening, I forced myself into a dress that hung loose on my 20-pound lighter frame. I'd lost my hair weeks ago. I wore a wig that made my scalp ache. I applied makeup to hide the gray pallor and took anti-nausea medication that barely worked. The restaurant was crowded and loud. 40 guests, family, friends, Melissa's fiancé's family. Everyone drinking champagne, celebrating. I found a quiet corner and tried not to vomit. "Alex, you made it." Melissa hugged me carefully. "Are you sure you should be here? You look really sick." Mom insisted. My mother spotted me and rushed over, her smile tight. "Alexandra, finally. Why are you sitting in the corner? Come meet people. And please try to smile. You look miserable and it's bringing down the mood." "I'm 4 days post-chemo, Mom. This is what I look like." "Well, put on a happy face anyway. This is Melissa's night." She lowered her voice. "And please don't mention your cancer to everyone. People came here to celebrate, not hear about your medical issues." She pulled me toward a group of her friends, other nurses from the hospital. "This is my daughter Alexandra. She does graphic design work. Not she has cancer. Not she's fighting for her life. Just she does graphic design work." "How are you, dear?" one of the women asked kindly. Before I could answer, my mother jumped in. "Oh, Alex is fine. She's been going through a little medical thing, but she's using it to get out of family obligations. You know how young people are, everything's dramatic. The women looked uncomfortable. One of them, Janet, who'd worked at my mother's practice for years, stared at me with recognition. Medical thing? Linda, isn't Alex going through cancer treatment? It's just routine chemo, my mother said dismissively. Very treatable. Alex tends to exaggerate how sick she feels. Janet's expression shifted to shock. Linda, chemotherapy isn't routine. It's brutal. Well, Alex has always been sensitive. She was a sickly child, always complaining about something. This is just more of the same. I stood there, swaying from nausea, listening to my mother tell her colleagues that my stage 3 breast cancer was attention-seeking behavior. Mom, I said quietly, can we not do this here? Do what? Tell the truth? You've been jealous of Melissa since the engagement. Admit it, you're using this cancer thing to steal her spotlight. The nearby conversations stopped. People were listening. I have stage 3 breast cancer, I said, my voice steady despite the humiliation. I had a double mastectomy in March. I'm halfway through 16 rounds of chemotherapy. I'm here tonight against medical advice because you insisted. I'm not jealous. I'm sick. My mother's face flushed. You're embarrassing me. This is exactly what I mean, you make everything about you. Janet stepped forward. Linda, stop. I've worked with you for 12 years. I've never heard you talk about anyone like this. Especially not your own daughter with cancer. You don't understand, my mother said defensively. Alex has always been dramatic. She's clearly not fine, another nurse said. Linda, she can barely stand. I'm a nurse practitioner, my mother snapped. I know when someone's actually sick and when they're exaggerating. Alex is exaggerating. The table behind us had gone silent. I recognized 2 people there, members of the State Board of Nursing. They'd been invited as friends of Melissa's fiancé's family. And they'd just heard my mother dismiss her daughter's cancer diagnosis. One of them, Dr. Patricia Chin, the board's clinical review director, stood up and walked over. Excuse me, Linda? Linda Hartman. My mother turned, smile returning. Yes, Patricia. How wonderful to see you. I'm sorry to interrupt, Dr. Chin said, her voice carefully professional, but I couldn't help overhearing. Your daughter has stage 3 breast cancer and you're calling it exaggerating? Oh, that. My mother waved her hand. Alex is fine. She just likes attention. Your daughter is in active chemotherapy treatment and you forced her to attend a crowded event against medical advice? I didn't force, she chose to come. You just said you insisted she attend despite being post-chemo. That's medically dangerous for an immunocompromised patient. Revelation. The conversation had drawn a crowd. Melissa was crying quietly. Her fiancé looked horrified. My father stood frozen. This is inappropriate, my mother said, voice shaking. This is my daughter's engagement party. For what? Dr. Chin interrupted. For pointing out that a medical professional is demonstrating dangerous clinical judgment? You're a nurse practitioner, Linda. You should know how serious stage 3 cancer is. How brutal chemotherapy is. I know my daughter. I know when she's actually sick and when she's seeking attention. Do you? Dr. Chin pulled out her phone. Because I'm looking at the complaint filed against your nursing license. Patient dismissed with chest pain, you diagnosed as anxiety without diagnostic testing. Patient had a myocardial infarction 12 hours later. Does that sound familiar? My mother went white. How do you? That's confidential. I'm on the State Board of Nursing. Your review is in 3 weeks. I wasn't assigned to your case, but I'm familiar with it. 6 similar complaints over 2 years. A pattern of dismissing patient concerns as anxiety or attention-seeking. The room was silent. And tonight, Dr. Chin continued, I've witnessed you do exactly what those complaints describe. Except this time, it's your own daughter with documented stage 3 cancer. Patricia, please, my mother said desperately. You're misunderstanding. Am I? Because I just watched you tell a room full of people that your daughter's cancer treatment is just routine, and that she's using it for attention. I watched you minimize her suffering. That's not misunderstanding. That's witnessing the exact behavior your patients have been complaining about. Janet spoke up quietly. Linda, is this true? The complaints. They're overreactions, my mother said quickly. Patients don't understand. I understand, I said, my voice stronger. I understand that you've been doing to your patients exactly what you've been doing to me. Dismissing them. Calling them dramatic. Alex, stay out of this. I can't stay out of it, Mom. I work with the State Board of Nursing. I'm a medical illustrator who creates nursing education materials and reviews professional practice cases. I recused myself from your complaint review because you're my mother. But I saw the file. I know what you've been doing. My mother stared at me. You, what? I've been consulting for the State Board for 6 years. I serve on the Practice Review Committee. Your complaint was assigned to my committee. I disclosed our relationship and recused myself immediately. But I saw enough to know that the patients complaining about you are telling the truth. You had no right, my mother started. I had every right. It's my job. And those patients deserve to be believed. Just like I deserve to be believed when I tell you I have cancer. Dr. Chin nodded slowly. This is extraordinarily concerning. Linda, your nursing board review is in 3 weeks. I wasn't on your panel, but I am now. I'll be recommending a full investigation into your clinical judgment and patient care practices. And I'll be including tonight's incident in my report. You can't do this, my mother whispered. My career. Your career is based on patient trust. You've violated that trust repeatedly. And tonight, you demonstrated exactly why those complaints against you are credible. Melissa was sobbing. The party was ruined. Guests were leaving early, whispering. My mother's friends stood in shocked clusters. My father finally spoke. Linda, maybe we should go home. Sort what out? She demanded. Alex deliberately sabotaged my career. I recused myself, I said quietly. I followed protocol. You sabotaged yourself by dismissing patients and calling your daughter's cancer attention-seeking. Get out, my mother said, voice shaking. You've ruined everything. I didn't ruin anything, I said. I just stopped pretending that your behavior is acceptable. I walked out, exhausted and nauseous but finally free. Resolution. The nursing board review happened 3 weeks later. I wasn't on the panel, my recusal stood, but I heard the results. Dr. Chin had added her observations from the engagement party. Combined with 6 patient complaints and a pattern of dismissing serious symptoms, the evidence was overwhelming. My mother's nurse practitioner license was suspended for 2 years. She was required to complete remedial training in patient assessment and professional ethics. Her practice was shut down. 3 former patients filed malpractice suits. Her nursing colleagues submitted statements to the board. Janet wrote, in 12 years of working with Linda, I witnessed her dismiss countless patient concerns. After seeing how she treated her own daughter with cancer, I realized it was dangerous negligence. My mother called me once after the suspension. Are you happy now? You destroyed my career. I didn't destroy anything. I recused myself. The board made their decision based on patient complaints and your own behavior. You could have warned me. Warned you to what? Continue dismissing patients? Continue telling people their symptoms aren't real. I'm your mother. You're a nurse who violated patient trust. You're a mother who called her daughter's cancer attention-seeking. Those are the facts. She hung up. Melissa called the next day. Alex, I'm so sorry. About everything. About how Mom treated you. About not standing up for you sooner. It's not your fault. I should have defended you. Most people don't realize until they see it clearly. I'm just glad it's over. 6 months later, I finished my last round of chemotherapy. I rang the bell at the cancer center with Rachel by my side. My best friend who'd been at every treatment. The nurses cheered. My oncologist cried. My mother wasn't there. My father sent a text. Congratulations. Melissa sent flowers. You're the strongest person I know. My 3-month post-treatment scans came back clear. No evidence of disease. I was in remission. I celebrated by accepting a promotion. Director of Clinical Education for the State Board of Nursing. My job now was to develop training programs to prevent exactly the kind of negligent care my mother had provided. I used my mother's case, anonymized, as a teaching example. This nurse practitioner had 6 patient complaints over 2 years. I told rooms full of nursing students. Each described the same pattern. Dismissing symptoms as anxiety, refusing diagnostic testing. One patient had a heart attack. All because one nurse decided she knew better than her patients about their own bodies. The students listened engaged. The most telling evidence: this nurse treated her own daughter the same way. Called stage 3 cancer, attention-seeking. That's when the board knew the complaints were credible. After one presentation, a student approached me. My mother's a nurse. She does the same thing, dismisses patient concerns. I always thought it was efficiency. But after your presentation, I realize it's negligence. What are you going to do? I'm going to be better. I'm going to listen to my patients. I'm going to believe them. Then you'll save lives, I said. 1 year post-remission, I'm healthy. My scans are clear. My hair has grown back. I developed nursing education programs that prioritize patient advocacy and clinical empathy. My mother's license was reinstated after 2 years, but she never reopened her practice. Too many former patients had lost trust. We haven't spoken since her suspension. Melissa and I are close. She visits monthly, celebrates my scan results. My father remains neutral. I don't need their validation anymore. I survived cancer. I survived chemotherapy. I survived a mother who called my suffering attention-seeking. And now I spend my career teaching nurses to be better than she was, to believe patients, to investigate symptoms, to practice medicine with compassion. My mother destroyed her own career by refusing to believe that suffering is real. I built mine by ensuring that future nurses know better. Some lessons are learned through consequence. And I'm making sure the next generation of nurses never makes the same mistakes.